Well, welcome. This is the next installment of Beards, Boobs, and Babies. Here's my co-host, Keith. I'm Phil. We are the Beards, and with us today, we have Jordan and Kurt here to talk about breastfeeding and formula feeding.
It's great to be here, Phil and Keith.
Yeah, thank you. Your beards are looking great.
Thank you for the invite.
Yeah.
Thank you.
Yes.
We
What a
just
good beard day to you.
we just went through November. We did No Shave November.
We
We
did.
all
I am the
so-
latest. I am trying.
You have joined the tribe.
I have,
bearded
yes.
folks.
And we're always glad to have
Thank you. I feel welcome.
One of us. One of us. Yes, we're
Yes.
happy to be here. Any beard news we need to talk about? Shave advice?
Not
Lately I've just been trimming the stragglers, keep it nice and
You have to
neat
manage it.
looking, but I still want it a little bit longer, you know?
Yeah, I'm working on the length, but you still have to do the occasional trim.
Well, you have
just
to
get
keep
rid
it
of
classy.
the,
You have to keep it classy, clean cut.
Right.
Right.
It's all worth it though.
It is until you reach like mountain man territory. You know.
Gosh, I wish my beard could be that way.
If only we were so blessed.
Yes.
God bless you.
Also with you.
All right, so we're here today to talk about infant nutrition.
Yes.
Um,
So tell us, Phil, what can you tell us about infant nutrition?
Well, one of the most staggering things for me that we've learned is the size of a baby's stomach when they're born.
Yeah.
One of the most stressed things being a new parent is how much is your baby eating.
Right.
I don't think parents realize that the actual size of an infant's stomach when they're
Right.
feeding, because it seems as though they want to feed them the entire amount that's in the bottle.
Mm-hmm.
Exactly.
And that's tough with bottle, even with breastfeeding.
Yeah, even
moms,
with
but
breastfeeding
bottle
too.
feeding,
Yeah.
you see this full bottle and they're trying to shove it down the kid's throat. But actually,
Right.
when the baby's born, it's the size of a chickpea. It's 5 to 7 milliliters. So that's not much at all. And
No.
women who are expressing colostrum, they're not getting much out, and they don't know how that can suffice for their child. But really, it's a decent amount for a small stomach. So.
Right. So what are the sizes of those?
So you got 5 to 7 milliliters at birth, and then by day 3, it gets up to 22 to 30 milliliters, which is the size of, if you're familiar with marbles, the shooter marble, the bigger marble. And then by day 7, it gets to 45 to 60 ounce or milliliters. So that's the size of about a ping pong ball.
Yeah. I mean, that's a pretty good size for a week, but I guess educating mothers on the size of the infant's stomach before, even just throughout how it progresses from day 1 to day 7
Yeah.
Absolutely.
would be extremely important.
Well, and the signs that your baby's getting enough food is huge to these mothers. I mean, good ways checking their diapers. You have up to 6 to 10 wet diapers for hydration, and then 1 to 3 stooly or poopy diapers per day.
And to me, that seems like an awful lot of diapers. If my baby was producing less than that, I might think that they're okay.
Yeah,
No,
yeah,
Absolutely.
absolutely.
Yeah, you definitely
Absolutely.
have to educate on the amount of.
Well, I don't go 3 times a day, so. But also making sure that your kids grow, and that's the sign of good nutrition. They have recommendations now, because breastfeeding and formula feeding both supply adequate nutrition to the babies.
Right.
But in certain places, like if you're not in the city where there's fluoridated water, they suggest to supplement some fluoride. Vitamin D is big to give to children, and then iron, because their iron stores are used up so quick.
Right,
Recommending some supplementation for that. So
Let's go over some of the benefits of breastfeeding. We've got, for the infant, there's decreased risk of having an ear, upper gastric, or upper respiratory infection. You have decreased risk for asthma, decreased risk for obesity and diabetes later on in life. For the mom, you have weight loss, prevents cardiovascular disease, decreased risk for hemorrhage, decreased risk for cancers. Most staggering statistic that I have here, only 21.9% of mothers exclusively breastfeed
Wow.
the first 6 months of the child's life.
And with all those benefits, you'd think, that number should be much higher.
It makes you wonder what kind of factors are
Coming into play.
to inhibit the breastfeeding.
A lot of women nowadays are working more, so they're going back to work sooner, or some of them are college-age kids that are going back to school.
Well, if you don't mind if I interject here real quick, from the bottle standpoint, not all mothers can breastfeed. Some of them, their milk never comes in. That's what personally happened to my mother. I was not breastfed. It wasn't an option for my mom to breastfeed me. But we all know here that breast is best. But given the circumstances, if it's a choice that the mother wants to make, we have to educate them on the benefits of bottle feeding as well.
Absolutely.
And I have a couple of those. I mean, with bottle feeding, it's wonderful because any family member can engage with the newborn and have that bond. But also
great for dads.
exactly, dad gets to get in on helping the baby. Mom gets a little bit of a break.
Do a little skin to skin with the dad.
Exactly,
With the bottle
exactly,
feeding.
exactly.
You feel more
Maybe
part of the
some
process.
Beard to skin as
Oh.
well.
Beard to skin, absolutely.
Absolutely.
Babies love beards.
They do.
I think that's statistically proven.
It is, okay?
I think
Not only
Harvard
that,
did a study
okay.
on that actually. Let's look
Is that
that
true?
up.
Further episode.
I'm making a note of that.
I wouldn't
right
be
now.
Absolutely.
surprised if it was.
And we were
scientific.
talking about the size of the newborn's stomach.
Yeah.
And not always with bottle feeding, it helps new parents with that reassurance that their baby's getting adequate nutrition. Because
They can see it going
they
in.
can see the measurement versus when the baby's at breast.
Right.
And it can also help with routine feedings. I know that the latest and greatest is feed on demand. If you're trying to make a routine, trying to make it a little easier on mom, or if you have twins per se, and one of them's up and one's hungry, we can feed the other one at the same time.
Sure.
Make a little bit of routine, make it easier on mom or even dad.
Speaking of volume going in with breastfeeding, how do they tell how long should baby be on breast?
For the duration of their childhood kind of thing, like
Well, per
infancy
feeding.
to per feeding. I mean, it depends. It's basically whenever the baby stops feeding. It's when they either delatch or stop, swallowing the bottle milk. Is essentially when they're done feeding.
Okay.
And
And-
infant feeding is basically on demand at that point.
Yeah.
Right.
Yeah.
Yes. And correct me if I'm wrong, but you should be doing breastfeeding and bottle feeding as well every 2 to 3 hours.
Oh, that's
Yeah, absolutely.
yes, that's very true.
Okay.
All right. Well, we've done some interviews. Keith has gone around campus, so we're gonna go take a look at that, see what the general consensus is on breastfeeding.
So we're here on campus today to conduct interviews and see what people on Lake Superior State campus think about breastfeeding versus bottle feeding. So we have Professor Kopke here. Tell me, what do you think about breastfeeding?
I firmly believe in it. I think it's best for the child to be breastfed if at all possible for the mother to provide that. If not, maybe to express her milk so that she can still provide it for the child. I think it's a very special bonding time between mom and child.
Well, tell me, is there? Do you think there is a place for bottle feeding?
I believe it's a woman's choice. I think the parents, should discuss it. What's the best option?
Pro breastfeeding. I think it's awesome. It's really healthy for the baby.
Yeah, I mean, I'm never going to have to, but I definitely think it's important. It's like a natural part of,
What do you think are some of the benefits to each one?
Well, breastfeeding, the baby derives its immunity from the mom's milk for the first 6 months anyway. So, it's a huge benefit.
So from a scientific standpoint, there's no doubt that it's the most beneficial out of other option. I've actually had a senior thesis student who did a study, and we got volunteers to provide breast milk, and we tested certain gut bacteria to see what it would promote versus inhibit the growth of, and it clearly supported the growth of like lactobacilli, all of those microflora that would normally keep the baby's gut clean and not have them, have gastroenteritis issues or anything like that.
Okay. Well, now that the audience has had a chance to take a look at the interviews we conducted, let's kind of just discuss what we saw.
Well, it was nice to see that a lot of people kind of realized how good breast milk is for the infant.
Mm-hmm. The consensus really did seem to be that breast is best.
Yeah.
And that just makes your statistic that only 21% of women exclusively breastfeed is really shocking.
I know. I wish it were higher. There's interventions that we as nurses can implement in order to promote breastfeeding, because there are the mothers who are able to that decline breastfeeding.
Yes.
Seems to come down to time.
Yeah, it really does.
Takes a
Working-
lot to keep up with the demands of breastfeeding, and even with pumping, it's.
Right.
I could understand how mothers could get discouraged and turn away from.
Yeah.
Which
And there
would
are-
turn them to the formula. It's
Exactly.
you heat up the bottle, you give it to the baby, life's good. The one young lady did mention that she didn't have although she realized that breast was best, she did say that she wasn't anything against formula, which is important, because
It's not bad.
No, it's not. It's the issue is that all formulas are trying to mimic breast milk, because breast milk is the best way to go, most holistic for the baby.
Right.
Um,
Can I interject something?
absolutely.
I do want to mention that breast milk isn't always the best for the infant. Factors such as the infant's not latching and they need the nutrition, they just won't latch, so you have to supplement bottle feeding. If the mother has, if she's HIV positive, you can't breastfeed, or else that will transmit to the infant.
Coming back to the bottle, there's definitely downsides to the bottle feeding as well. There's the cost. The supply's there. It's just the time that the mother has to dedicate.
Yeah.
The formulas can have a wide variety of costs, and can cost anywhere from $54 a month, anywhere up to almost $200 a month.
Wow.
So that's,
Significant.
you do have a newborn, and you did just get back from the hospital, and you have bills that need to be paid there. One of the last things you want to think about is, are you going to have the money to pay for formula this month?
True.
Absolutely.
Okay.
That's very true.
And there is also the issue that sometimes the baby's GI tract does not tolerate the formula like it does the milk.
Well, there's a lot of properties in mother's milk that coat the GI tract. That they're
Yes.
not getting.
Yes,
Exa-
absolutely. We
yeah,
had the
exactly.
interview with the biology professor on campus
We did.
who told us about the normal flora that are actually introduced as well from breastfeeding.
That's a cool thing.
Yeah,
It is
it's
very cool.
I'm sorry. And she also explained to us how she believes that, because she had twins, she believes that getting breast milk to the babies, at least in some amounts, was better than nothing. So she wasn't exclusively breastfeeding per se, but she was doing a little bit of breast, a little bit of formula. And really, that is a great way to go.
Yeah.
Team effort.
Absolutely. Personal experience. I have twin sisters, and I know that it's difficult, especially for a mother that had with two babies. She can't produce enough for both babies, so you have to supplement with the formula.
And it's important to let people know that it doesn't have to be this or that.
It's not the
You
end
can
of the
do
world
both.
if you
Yeah.
have to.
Yes. Yes.
Absolutely.
Well, I think we've covered breasts and bottles pretty much sufficiently. How about solid foods? What
Yes.
are we?
Research has shown that 4 to 6 months is the time you want to start introducing solid foods. If you follow the breastfeeding recommendations of exclusively breastfeeding for 6 months, you would want to start introducing solid foods at 6 months.
It's also up to a year that you can breastfeed, or you should breastfeed. It's exclusive for the first 6 months, and then you can.
Yes, and then you start to introduce solid foods along
you
with the
can-
breast milk.
Or you do breast milk and bottle feeding and solid foods if you really
Yeah,
wanted
right.
to.
Yeah.
But why not before 4 or 6 months?
Earlier than 4 months, the children have a higher risk of allergic disorders. They found, and other GI issues. Some signs that your baby is ready is if they are able to sit up and hold their head up on their own. If they start to show interest in what you're eating. If they kind of start to mimic the actions of eating.
Or
Are some
if
signs.
they start talking to you, you should probably transition to solid foods.
Yes. Yeah. Absolutely.
that would
So the best way to go about introducing solid foods is number one, you usually want to start with cereal.
Sure.
So you would mix that with your breast milk or your formula, the cereal, and then feed that to the baby at first.
Are you going to want that to be mushy, or you want it to be hard, solid?
You don't want it to be sticky. Like if you think about oatmeal, you want it to be you don't want it to be sticky oatmeal. You want it to be pretty runny,
Okay.
pretty much liquid at first, and then you can slowly start to transition into a little bit thicker.
Okay.
To get the baby used to that kind of, chewing, mouthing it,
Yeah.
swallowing
It's
it.
like applesauce.
Well, he's got
Yeah, absolutely.
You got to learn a new trick. He's got to learn how to, chew his
Right.
food and whatnot.
And that'll help prevent choking in the infant
Absolutely.
as well.
Yes. And it's important to
Child.
avoid foods that could be a choking hazard, such as grapes, cut up hot dogs,
No hot dogs.
nuts. Yeah, no hot dogs.
No,
What about ice? My
I-
my niece and nephew loved ice when they were kids. Is that,
Ice cubes would be dangerous. It's not as big of a deal
That's
because
not
the
a
ice
food,
can
but-
melt away,
yeah.
but still it's a potential choking hazard. And also, when you're introducing foods, you want to introduce foods one at a time, and you want them to be single ingredient foods. So when you buy those little jars of pureed carrots, you want to make sure you look at the ingredients and that it's just carrots. You don't want to have carrots with lots of added sugars or any other ingredients. And that's important because you can find out when you do it one ingredient at a time, one food at a time, you can narrow down food allergies, and you can slowly introduce their GI tract to these new things.
That way their system's not on overload either.
Okay. Well, I think that's it for this segment. When we come back, best beards on campus.